Hi, I'm Julie. I've got 3 children. My eldest child, Katya, has a vagal nerve stimulator fitted. Katya has a neurological migration disorder. She has a condition called Lissencephaly, which basically means Katya has a smooth brain. So as a consequence of that, Katya has a very complex seizure disorder. During the course of trying to get some measure of control with Katya's epilepsy, we did, from the age of 8 months up until she was 10, when she had her VNS fitted, we tried 8 different drugs, which was really, really difficult because they mostly all have really horrendous side effects. At the moment, she's on a combination of 3, which works quite well for her, but the biggest thing that's worked for Katya is the vagal nerve stimulator, the VNS.
My name's Kate. I'm one of the lead epilepsy surgery nurses at the Bristol Children's Hospital. I first met Katya and her parents, Julie and Nick, back at the beginning of 2010 when they were admitted to the Bristol Hospital for their investigations as part of the Children's Epilepsy Surgery programme. We then had a multidisciplinary team where the neurologists, neurosurgeons, psychologists, psychiatrists, epilepsy nurses and radiologists sit, look at all the information gained and decide on an outcome, and in this case it was for vagal nerve stimulated therapy.
Okay, when Katya was checked in the morning to have her surgery at French Hospital, and she had the surgery was really quick. It was so much quicker than we expected, and she was out of theatre really within an hour or so, and she spent the night there just to be observed, check everything was okay.
Vagal nerve implantation is generally a day case procedure. In some instances, if some of our families have travelled long distances, we do keep them in overnight for monitoring.
More or less as soon as the VNS was activated, we noticed a change in Katya's seizure frequency. She was having less seizures, she was sleeping a bit better, she was a lot more alert than she'd been before, and amazingly she went from having rescue meds every day. I think in that first week she only had rescue meds once.
I also attended the school after the VNS implant to educate them on vagal nerve stimulation and how to use it and how to care for the device, and they too were astounded at the change in Katya, especially her alertness and communication.
We haven't really noticed any side effects apart from the one. We did have a bit of an issue with drooling, but that's been rectified and we don't have issues with that anymore.
Part of the vagal nerve stimulator therapy consists of using a magnet which carers parents can use to activate the device at the start of a seizure or during a seizure. The aim of the magnet is to either hopefully stop the seizure, to reduce the length of the seizure and to reduce recovery time. Katya had a VNS generator replacement approximately 7 months ago, and we felt she was a good candidate to try the new VNS device, which has got an added auto-stimulation that is triggered by an increase in heart rate. The idea being behind the new VNS device having the auto-stimulation is that it is beneficial for those patients who are suffering from nocturnal seizures, or those patients who are not having an aura before a seizure, so they're not aware to swipe their VNS with a magnet, or they're physically unable to swipe themselves. It has a very positive effect on Katya, on both her seizure outcome and on her quality of life. The family have also found that they are using the VNS magnet less since the new device has been put in.
Okay, now with the VNS, life has changed hugely, not just for Katya but for the whole family. I would say she has her quality of life back. Before she had it fitted, really for 2 years we didn't see her smile, we didn't see her move around on the floor, and now she's shuffling around everywhere. She's much more interactive, she still has good days and bad days, but she's a much happier child. She smiles all the time, she's a really happy little soul, and it's meant as well that as a family we can do more things together, because when she's out, she's fitting, we can control things a lot better with a magnet. If I could turn the clock back and if the VNS was available, when Katya was 3 or 4 or even younger, I would do it in a flash, because what we've put her through with all the different drugs over the years, you can't, you just go on a drug, but you can't just come off a drug. You know, withdrawal on a few occasions has nearly killed her. And I do sincerely believe that if Katya didn't have the VNS, she wouldn't be alive today.